Hi, we are team number 8, and this is our activity of biosensors. In the middle of a public health crisis in CDA, our team's task is to propose a biosensor capable of detecting and managing a viral outbreak. The evaluation will focus on the solutions design, deployment strategy, anticipation of potential challenges, and understanding of the virus's behavior. CDA, a densely populated metropolitan area with 1 million residents, is grappling with a public health emergency caused by an outbreak of a newly identified pathogen called OPS. Local health authorities are in need of a versatile biosensor that can be deployed in various settings, from healthcare facilities to community-based point-of-care locations, to detect the virus in individuals. Scenario analysis: the main challenges include identifying the OPS pathogen, high sensitivity and specificity for detection, adapting to diverse environments and sample types, fast response time, data privacy and security, scalability and equitable distribution. A good biosensor is a cornerstone in modern healthcare, playing a pivotal role in early diagnosis, personalized medicine, proactive healthcare, and overall improvement of patient outcomes. Its impact extends beyond diagnostics, influencing treatment strategies, resource utilization, and the future trajectory of healthcare technologies.
For the initial symptoms of the this infection, we have mild fever. These affect individuals that may experience a moderate increase in body temperature. It's usually not exceeding 38 Celsius. We also have fatigue and general discomfort. These can be early symptoms, which can make individuals feel exhausted without apparent cause. We have sore throat. Some patients may experience a sore throat and discomfort when swallowing as one of the early symptoms. We also have, for the late symptoms, we have difficult breathing. In some cases, the disease can severely impact the lungs, resulting in difficult breathing. We also have pneumonia. This manifests with persistent cough, production of bloody sputum, and chest pain. And we also have confusion and altered mental state. In some cases, this can affect the central nervous system, causing confusion, altered mental state, and neurological problems. For the biosensor design, we have specific antibodies. This is to detect the presence of the virus, and we also have nucleic acid probes. This is for pair with the DNA or RNA sequence of the functional virus. Also, these proposals will be used since they are well known methods in which detecting the virus. This is important because these tests have very good precision and accuracy.
We decided to use an optical method that is called transduction method. This method consists of fluorescence that when a specific antibody or nucleic acid of a virus react with this substance will produce a color change. This color change will indicate a positive result, and if there is no color change will be negative. So there are many advantages and limitations of this fluorescence method. The principal advantages are the speed of these tests and the cost because they're really cheap. And some limitation will be the control of the methodology because these type of tests have a specific methodology that will be need to be teached to the people that will conduct these tests. And many human mistakes can affect the results, positive or negative results. Also, our deployment strategy will consist of these bullet points, the training for professionals. As I already said, these methodologies are very specific, so professional will be need to know the methodology very well. Or another point is the data collection interpretation because these are results of color change, so the interpretation of the results will be need to be fully understood. Also, the accessibility and user-friendly design for people or patients that will conduct their own test. It will be very useful. Also, this all data collected by patients and point of care location will be centralized in a huge system. And in last instance, will the public awareness and guidance with some TV propaganda and social media.
The biosensor specifications for healthcare center are high sensitivity. This is because we want to detect even low concentrations of the fictional virus in the patient samples. A high specificity. This is because we want to avoid false positives, a very high accuracy, and a reasonable measurement time that is going to be slightly longer than the measurement time in the point of care. And biosensor specifications for point of care are reasonable sensitivity. And this is because biosensor is used in patient care locations such as pharmacies or public transport stops. So sensitivity should be good enough to detect infections, but might be slightly less sensitive than in a clinical setting. Also, we need a high specificity. This is to avoid false positives, acceptable accuracy. Uh, this accuracy should be enough for quick decision making at the point of care, and also a fast measurement time because in this environment speed is essential, so the biosensor should provide results in a very short time to enable quick and efficient decision making.
We have seven main challenges in this project and a mitigation plan for each one. The first challenge is the supply chain disruption. To mitigate this, we plan to establish backup suppliers and ensure that critical materials are stored to mitigate disruptions. The second challenge is the user errors can impact the trust of our biosensor. To address this, we are designing the biosensor user-friendly, so we need to have clear instructions and support materials. The next challenge is that we need to ensure regulatory compliance for the success of our project. To mitigate this, we are collaborating with regulatory agencies right from the planning phase. This ensures that our biosensor has all relevant regulations and standards. Now, the risk of false positive and negative is a concern. To mitigate this, we are continuously improving the biosensor's sensibility and specificity through research and development. The next challenge is scalability. Scalability is crucial during outbreaks or high demand. To address the challenge, we are prepared to rapidly increase production and distribution as needed. In remote areas, access to biosensors can be challenging. To mitigate this, we plan to collaborate with NGOs and local organizations to ensure access for everyone and everywhere. The last, but one of the most important, is the rapid virus mutations, and we must stay ahead. To address this challenge, we will stay updated with scientific research on the virus and be prepared to adapt the biosensor to quickly detect new variants.